Welcome to the virtual information session on the Masters of Science of Nursing program here at the University of San Francisco. We're glad to have you attend. My name is Mary Seed, and I am chair of the Masters of Nursing program or department here at USF, and I'm also the program director for the RN to MSN portion of our curriculum. So I'm glad to have you here. And also here with me is the graduate admission recruiter, and I'll let her introduce herself.
Hi everyone, I'm Tamara White. I am the graduate admissions recruiter. So I am here to assist you with any admissions related questions that you might have. So welcome to our webinar.
But today we're going to cover about the University of San Francisco and why you would want to choose to come here. We're also going to talk about the history of the Clinical Nurse Leader Program. Our Masters of Nursing program here at USF focuses on the Clinical Nurse Leader track. We'll also talk about what the role of the CNL is so that you have a clear understanding why you would want to come here to get your degree as a CNL. And we'll talk about program goals and details so that you get a good feel of what the program entails and the admission requirements. Tamara is going to cover those at the very end.
One thing we'll like to also add is that this session is specifically for current registered nurses. So if you are on the line and you're interested in becoming a nurse or you're interested in the MSN for the non-nurse, you may want to just check out our website for upcoming open houses and information sessions.
University of San Francisco is a private Jesuit university. We have 4 programs. Nursing and health professions is what I'm going to focus on today. We also have a School of Business that's been around for quite a while and has an excellent reputation. A law school, as you probably have heard of, and liberal arts and sciences. We also have a education, EDD, PhD, and MFT in our education school. So we have over 100 degree programs and over 9,000 students on the Hilltop campus and branch campuses. Our School of Nursing has 1,100 undergraduates, that's BSN students, and we have 400 plus graduate students, and I'll get into a little bit more detail about our graduate programs and break them down for you. We're the oldest university in San Francisco and the second oldest institute for higher learning in California. And we've been here 150 years of Jesuit tradition. And I'll explain a little bit more detail as we go on about the Jesuit tradition and how the School of Nursing and Health Professions really embraces those values. All programs are accredited by the Commission on College of Nursing Education, CCNE, and approved by the California Board of Registered Nurses. We just had our 10-year accreditation visit in September, and we passed, so that was all great. And so we're set to go for a while with that. We have notable faculty, the dynamic faculty and student interactions, and I really wanted to highlight that because even though we are a teaching institution and we are tuition driven, the university has also made a very strong commitment to the faculty and scholarship. So your faculty that will be teaching you in the program are given research release time, are active in research, active in conferences, actually have taken leadership roles. For example, I was on the commission for the CNL exam, a national commission for 3 years, and we have 7, I think, faculty that have published books. So you really do get a dynamic faculty. We also have quite a few faculty that do international trips and so forth to Vietnam and to Korea. That's the other one, trip, immersion trips. So Mexico. So anyway, I think that's exciting for you if you choose to come to USF. Our CNL faculty that will teach in the curriculum are CNL certified, and I'll talk to you a little bit later about the CNL certification exam, which you will be eligible for if you come to our program and complete our program. So the faculty are committed to the CNL and have knowledge of that exam process. We're excited that we have so many branch campuses that you guys can take advantage of. You can take classes that are most convenient for you. We have a branch campus here on the hilltop at San Francisco. We have a campus in San Jose, Pleasanton, Santa Rosa, and 100% online. And so that program's been going for a couple of years and is a great option for some of you that would like that. We are looking at future campuses in Sacramento and Orange County, and Orange County is very new, and so we don't have the date that those would start, but we are expanding down to those to Southern California and Sacramento. And I just want to make sure you know that the admission cycles vary by location. So, for example, San Francisco, we start in a fall only. They start in fall, where San Jose starts in spring. And so you can check our website to see campus locations. Because they don't start, the programs don't start every semester, it is a cohort model, and once you start, it is hard to jump between campuses. We have had that happen, and it can work out a customized curriculum, but it doesn't go quite as smoothly, so just keep that in mind. So a little bit about our academic programs at the School of Nursing and Health Professions. I mentioned that we have a Bachelor's of Science of Nursing. It's over 50 years and is well established in the community. Agencies like to hire our graduates, and many of our managers and CEOs and leaders in our hospital settings came from our bachelor's program. So we have a Master's of Science of Nursing, MSN, which I'm talking to you today about. We have different tracks. So as Tamara mentioned, we do have a non-nurse track. That's for somebody who has a degree in another field and comes and gets their RN and their MSN CNL, and we are not going to be fielding questions about that program today, because this is focused just for the RN nurse who is coming back to get their MSN, and that's for you registered nurses. We also have a Doctor of Nursing Practice, DNP, and we have a BSN to DNP or an MSN to DNP, and these are the 4 tracks that we have for the Doctor of Nursing Practice, and I believe we're going to be doing webinars on those programs if you are interested in them, and there's more information on our websites and informational sessions. They are not offered at the branch campuses, they're just offers at the Hilltop campus. So in addition to that, in the last 2 years, we've started quite a few other health science degrees, and our dean, Dr. Karshmer, has a vision of really embracing the interprofessional health science work that is being done across all settings now, and I really believe that we needed to mix our classes with other health professions to embrace that ideal. And so we have a Master's of Public Health, a Doctor of Psychology and Clinical Psychology, which is PsyD, a Master's in Behavioral Health, Healthcare Informatics, and Healthcare Simulations, a Master's in Healthcare Simulations. Changing the world from here is really the Jesuit mission that's posted pretty much everywhere. If you guys see our advertisements throughout the city, Change the World from Here is our slogan. And like I said, School of Nursing and Health Professions is really embrace that in preparing health professions who provide a moral compass to transform healthcare in order to promote equity, positively influence quality and delivery and access to care. So we really feel like the USF Advantage, which is over 150 years of Jesuit education, has really put us on the forefront of that ideal. We have a high standard and a passion for justice. The mission of the school is to advance nursing education within the context of that Jesuit mission or tradition, like I mentioned. So we embrace diversity, social justice, leadership, and critical thinking. So we put this slide in here. I put this slide in here for the National League of Nursing model of nursing education, because I just wanted to give you a little bit of a brief overview of where the profession is going in general. So this model came out in 2010, and it really helps you understand how the education has shifted in nursing. And you'll see if you start at the bottom, practical vocation and then associate diploma nurse. Those are your RNs that worked at the bedside, have strong technical skills and so forth. Then the baccalaureate nurse, again, that's nothing new, a master's or a baccalaureate degree. What's happened is the shift to the master's level, and so the master's level is no longer a specialty where you get a clinical nurse specialist or a nurse practitioner at the master's level. Those specialized master's degree have moved up to the doctorate level, and you'll see the doctorate level at the very top has a practice focus and a research focus. And so the practice focus is putting our practitioners, our specialty, whether it be wound care, geriatric, nurse practitioners, at a doctorate level. And we still have our PhD when we certainly still need nurses to do research. And so the doctorate level has is split off. So at the master's level, this model and the vision that nursing leaders in the United States have is put the master's level. There's really 4 tracks that are offered at the master's level. It's nursing administration, nursing education, and the clinical nurse leader. I'm sorry, I think there's a 4th one, but I'm drawing a blank. It might be a leadership one as well. But anyway, so they're more generic masters or more basic masters, where the specialty, like I said, the CNS or the nurse practitioner specialties are up at the doctorate level. So the clinical nurse leader came out, the vision came out in 2004, and it was took 2 years to develop, but it basically the American Association College of Nursing, who designs our nursing curricula or leads the changes in our nursing curricula, got together with executives from a variety of practice environments and said, we need a new type of master's level prepared nurses that can deal with these system issues that are going on in healthcare, who can really look at patient outcomes and improve systems. And so with it, 2 years of bringing people to the table, they came up with the clinical nurse leader role. As I said, it emerged from several years of research and really wanted to engage clinicians in becoming outcome-based practice and quality improvement strategies. The CNL is a leader in the healthcare delivery system in all settings in which healthcare is delivered, not just acute care settings. And a lot of folks that come to us say, well, it does sound like it's for the acute care, and it was designed out of the hospital's need for medical errors in the initial workings of it, but the actual curriculum and so forth is really not focused or meant to be acute care only. For example, school health also has to have nurses that are outcome-based and looking at cohorts of patients to improve, or clients to improve their care and outcomes. So it really does carry across all settings. Home health, we've had students that work in home health and ambulatory care, and like I said, school health, and so there is those opportunities. Jails, correctional facilities have also come to our program, so there's quite a few settings. And basically, they designed a role for a nurse that would be prepared with the competencies needed to thrive in the current and future healthcare systems. I put the website here. If you want more information, AACN has a CNL website that has articles and about the CNL. There's different videos, all sorts of information that I really encourage you to go to look more and to read more about the CNL and what it's offering and what it's doing to transform healthcare right now. It's a very exciting time. As we started our first CNL program in 2006 here at USF, so we were one of the first schools, well, we were the first school to offer the CNL. And last year at the CNL conference, it was really exciting because people really felt that we are ready for healthcare reform and we have the skill set to move healthcare forward. So like I mentioned, it is at the system level, meaning any type. So the way I like to describe it is, so instead of your patient or your 4 patients that you care for in a day, or at the school, the patient, the diabetics or the patients that you're seeing, you really are accountable for the care outcomes for the whole population, or what we call a microsystem. So, in microsystem can be within a population or macro system, or it can be one in itself. So you're really accountable for care outcomes. You do coordinate care activities of others. You will learn interdisciplinary skill set to coordinate people, to deal with conflicts, to help move people forward so that the patient is centered and the patient care is optimum for improving outcomes, so that all folks that are in giving care are coordinated. You will develop organizational plans for delegating to staff and others, including teaching and evaluation activities. You mentor new grads, you mentor new nurses. The CNL is really the go-to expert within the microsystem. Interventions include evidence-based practice, revising guidelines, protocols, and management of clinical populations. And you're really responsible for the safe care of patients to achieve those positive health outcomes, as I mentioned. And I put down here in the little asterisks, just some bullet points. It's system focused. Point of care, meaning the CNL stays where direct care is given or where clients are taken care of. Improve patient outcomes, and then focus on health promotion, so bringing those health promotion initiatives to the setting. And then a big part of it is reducing cost. And the CNL movement here in California is taking off. It's a little slower than on the East Coast, but what's been going on in the East Coast and some of the literature, which I encourage you to look at to see what the CNLs have done to reduce costs, is pretty impressive and is really helping the momentum of the movement. So our curriculum framework, before I go to our curriculum framework, just to give you an idea of what the coursework would look like if you came to our program, I just wanted to also mention that the VA was at the table at the development of the CNL, and they have an initiative to put a CNL on every unit. They said by 2016, but that's probably not very realistic, but there still is a huge initiative. And I don't know if you guys watched Frontline on Sunday, but the new VA director was on, and they're really going to be upping their employment numbers there. So there's a lot of great opportunities in the VA system for the CNL. So one aspect of the framework is nursing leadership, and it's horizontal leadership. So you're not being trained to be a manager. You are trained to be a leader, and you work horizontally with the manager. The manager has to usually deal more with budget issues and FTEs and so forth. Yours is really focused more towards the patient outcomes. You have to be effective use of self and communication. You're an advocate for the clients and families and for the other people on your team. Concept analysis of the CNL role, we'll be teaching you because it is a new role. And then lateral integration of care. A lot of medical errors were on handoffs, as you know, and so there's a lot of resources, and the CNL is really trained to really help smooth off those transitions from one microsystem to another. Because you're an outcome manager, you do take a class on advanced patho and pharm assessment, because you are considered an expert at the bedside or at the point of care. I shouldn't say bedside, but at the point of care, so you're a go-to person for those chronic and really complicated cases. You will obviously promote health outcomes. I think health promotion, I think the most common one is like smoking cessation, and making sure that clients that come into a hospital, for example, that have are still smoking are given those opportunities to quit smoking. So really looking at how to prevent people from coming back into the hospital. And that also reminds me at the CNL conference, transitional care is very big now, and they're as a movement to helping having a CNL that is working in the hospital who also works for the new consulting companies that are in charge of transitional care, to making sure that the populations move from the acute care setting out into the community effectively. As you might have heard, there's been a lot of the problems with the Affordable Care Act as identified has been around missed appointments and not getting prescriptions and so forth, so that there's a high readmission rate. Evidence-based practice, you'll take a nursing inquiry class where you will learn how to critique and use the literature, and then more importantly, just how to get it into practice and implemented and doing small tests of change. Care environment management, that's your team coordination, finance and cost, so you will take a finance class. Your leadership course is real focused on systems and organization. Healthcare policy, writing policy, quality improvement, those are your lean projects, your root cause analysis, failure mode effect analysis, and the others. I think Sigma 6 is the newest one coming out, and then informatics course. And if you want a more detailed look at our curriculum pattern, I encourage you to go to our website. It's posted there, and you can kind of get specific course content. So program details. The program, it's a 2-year program. It's 3 semesters per year, so a total of 6 semesters. And you do go during the summer. And the summer is a little bit condensed and a little bit, what's 12 weeks versus 15 weeks, so it is a little more condensed. So it is a fast-track accelerated program. It is designed for the working RN. So we have a blended model or a hybrid model, and that is where you come to class the same evening once per week. And they will be on the same day per week for your whole 6 semesters. If you choose one campus. So for Pleasanton, it'll be that one particular day, which might be a Tuesday, Wednesday, Thursday. And how it works is you usually take 2 classes per semester, and one class will be online, and the other person, and that same week, that class will be in person. And then the following week, it switches so that the other class is in person and the class week before is online. So you basically see your instructor every other week live, and then every other week online. And you stay with the same cohort, and you move with that cohort. So you get to know your classmates fairly well. I mentioned the choice of campuses. We have San Francisco, Santa Rosa, San Jose, and Pleasanton. And we do have split tracks. So associate degree nurses, and if there's any diploma nurses on the call or in the webinar, they have their own track, and then we have a track for the Bachelor of Science nurses. So the first 3 semesters they take two different courses, or take different courses in the first 3 semesters, and then starting semester 4 they move into the same curriculum. The associate degree nurses need to take community health, and we have them also taking some introductory research courses and writing courses than the baccalaureate nurses. And then again, we have our 100% online curriculum, and that curriculum has been going for 2 to 3 years, I think, now, and so that's a great option for those that don't want to be in person. So the ADN program is 46 units, and the BSN track is 35 units total. So for the CNL Role Implementation, this is for your internship hours. And there's 400 internship hours. I think that's on another slide, but I'll get to it. It's 400 total hours. And our model is that you do these hours at your employment. And so when I do orientation, well, I'll talk to you about that, about seeking out or thinking about somebody that could be a liaison or a mentor that would help you implement some of the CNL roles that are defined in the end-of-program competencies for AACN. And it's not a traditional capstone liaison or mentor because they are not usually working in a CNL role. So they are just going to give you access or help you facilitate you to do the end of program competencies. You're pretty structured in the classroom, instructed in the classroom what to do for the internship hours, and this liaison or mentor just helps you accomplish that, or leads you, tells you where to go to the leadership meeting, or lets you have access to doing an educational module for your microsystem. Okay, so it's not traditional where you go in 8 hours and do it all of that person around like you would like a capstone. And we give you a copy of the end of program competencies. If you want to look at them and get an idea, you can go to the AACN website I gave you on the screen prior, and there's a white paper there, and in the white paper really lays out the competencies for this clinical nurse leader and the master's essentials. So here's the internship. It's a total of 400 hours. And how we set this up is 180 of your hours are accumulated in 3 role classes throughout this first 5, I think it's semester 2 through 5. So it's 60 hours that you start out with, and then you have a break, and then you do 60 and 60 hours. So it's spread over 3 semesters. Now, if you're already working in a management leadership position and some of the end of program competencies you're doing as part of your employment, that's fine as long as you're doing those competencies. Or if you're a staff nurse and you are asked to lead a staff meeting, or you're consulted on a chronic case and revise a care plan, again, that's part of the end of program competencies. Then it doesn't affect us whether you do those on your work hours or not. A lot of the managers on the unit, when they hear you're in a CNL program, will take advantage of your expertise and having you do initiatives that might be part of your employment, and that works out well for a lot of folks in our program. The very last semester is 220 hours, and that internship, now not all your hours can be done while you're employed. A lot of our students either go in on a day off, or they stay late and do something. Some of them work on the night shift and will stay into 4 hours a week late in that day. So there's a lot of flexibility when you do those hours. In the immersion of very last semester, semester 6, you do probably have to save some PTO and take some days off to get those 200 hours in. It's about 20 hours a week. And the deliverable, which would be in the old days like a master's thesis, is a quality or process improvement project. You write a final paper, and then we have a large poster presentation on the main campus where preceptors, other students, the dean, and faculty come and see your final poster. And the poster is a professional poster that you would see at a conference, and we do have many, many of our students take their posters to national conference. We had 7 students that presented at Texas Health at their regional CNL conference in October, so that was exciting. The project basically is best practices, and it's a meaningful improvement to the healthcare system in which you work. So it's really a great gift you get back to work, and they give for your education, and it just seems to turn out to be a win-win situation. After the end of your semester, and after you've done your 400 hours at the end of the last semester, you can take it at the very last semester while you're still in school, but most students wait. You are eligible to sit for the CNL certification exam. It's a national certification. It's really important for a lot of employers, and you will be certified as a clinical nurse leader and can carry the CNL title on your name tag as certified. Okay, I am going to turn it over now to Tamara, who is going to explain the admission requirements, and then we'll come back and for questions.
Thanks, Mary. So here at the University of San Francisco, we take more of a holistic approach when we review applications. So we're looking at your entire application before we make a decision. First thing, of course, is that we do require at least an associate's in nursing, bachelor's in nursing, or of course a diploma in nursing. And then there's a recommended 3.0 GPA. And this is really just to kind of gauge whether or not you can take on graduate level coursework. Now, if you have less than a 3.0 GPA, we would still encourage you to apply and not allow that to deter you. Because again, we're going to take a holistic approach when we review your entire application. We also recommend 2 letters of recommendation, and this can be from someone that you work closely with, a previous supervisor, a manager, or even a professor, anyone that can really speak about your work ethics and who you are and your passions and your goal, etc. Documentation of your RN license is required. It must be active. This is something that we also check for. So make sure that it is, relevant and active. And then there's also a statement of professional goals. This is an opportunity for you to explain who you are, why USF, what do you plan to do with this degree, and just give us an overall picture of who you are. And then, of course, a professional resume, which really details your experience, any volunteer opportunities that you might have had, and the leadership roles that you've held. We want to see those experiences listed. And then transcripts are required from all post-secondary schools that you've attended. And then, of course, because you are present on this webinar today, we will waive your application. So you will receive an application fee waiver via email as soon as the webinar is over. So you won't need to worry about the application fee. Now, we are still accepting applications for San Jose campus as well as online, although the application deadline has passed on October 15th. But if you do want to start in spring for our San Jose or online, you can continue to apply. We also have admissions deadline for San Francisco, Pleasanton, as well as our online campus for fall, which starts in August, and the deadline for that will be May 15th. And then in the summertime, we only admit for our online campus, and the deadline for that will be February 15th. Usually, you can expect a decision within 6 to 8 weeks of application deadlines. Now, in terms of financial aid and program cost, courses right now cost about $12.09 per credit, so it's a little bit over $1,200. And of course, if you have an associate's in nursing or a diploma in nursing, you can expect to take about 46 credits, which will give you an overall program cost of about $55,000 to complete the program. If you do have a bachelor's of science in nursing, you can expect to take about 35 credits, and the total cost would be about $42,000 a year. However, most of our students do qualify for some type of federal Stafford loan, which can be worth up to $20,000 per year. And then, of course, there's always Grad Plus loans and private loans. We also provide, some type of scholarship opportunity, but that's usually very minimal, and that information is usually provided to you once you've been admitted. So now we're going to open up the floor for some questions. I know you guys have been typing them in, but continue to use the control panel on the right-hand side of your screen, and we will get to the questions as we go along. So the first question, can I apply 100% online and then eventually switch over to an on-ground program?
Okay, so we have had students do that, and there is allowed some fluidness back and forth. We can't always guarantee that that the courses you need on the branch campuses will be available. Where on the online campus, they're available every semester, but on the branch campuses, because we only admit yearly, they may not always be available. So, for example, we have a student that wanted to go from online and just felt like the in-person was better, and to be caught up with the branch campuses, she's taking a leave of absence for 1 semester, and then she'll be able to move with that group. So it's just not as completely seamless as we, but we'll work with you is basically what I want to say.
So the next question, Can you talk a little bit more about your international abroad programs? You mentioned earlier about studying in Vietnam. Can you touch a little bit upon that?
So the Vietnam project is it's not a study abroad. We have two faculty that are working with the Vietnam project, and they do go, and students can go with them. Again, something that you apply for. We don't have funds for you to go, or there's limited funds, so usually the students do carry that cost themselves, and that they do apply to go over and see what they're doing. And that's same with the Mexico trip. The Mexico trip actually, and on the Central Valley trip, we have students in the CNL program. There's some scholarship money available, but I think it was about $1,500. The Mexico trip's $3,200. The Central Valley may have been, maybe it wasn't $1,500. I don't know the cost. It was lower. But they did get to do their community health practicum hours, and at both of these sites, they're 90 hours. And so instead of doing community work, they're 90 hours for their community health portion of 506. They were able to do those immersion trips.
Is the online program the same as the on-ground program?
Yes, they are exactly the same curriculum, and we share faculty, and they're pretty much the same. Now, it's a different dynamic. You're typing a lot more online. You're doing a lot more discussions, but you still get to meet everyone through the computer. The only difference is that you get more, the classroom interaction and the live interaction, but the curriculum is the same.
Now, what kind of role can I expect to get once completing this program? Will my title be a clinical nurse leader?
So you'll have a Master's of Science in Nursing, and you'll be certified as a clinical nurse leader. So that would be your credentials. Your title depends on the agency that hires you. The VA, for example, who's hiring the most CNLs, has you in an actual clinical nurse leader role. So you apply for a clinical nurse leader role, and you have to have the CNL certification. For example, John Muir has one CNL who is certified CNL, but is working as a patient care coordinator, or more of kind of like in the traditional CNS expert role. So it varies on agency, the actual title that they give you or you apply for. If you look on some of the websites, they very well could say patient care coordinator, CNL certification required, or it could be for a CNL. So it really depends on the agency. And part of the confusion when I was on the joint, or on the not the Joint Commission, on the Certification Commission for the CNL, they did a job analysis, and they found that the majority of the nurses or CNLs working in a CNL role were not called a clinical nurse leader. They were called something else. Case manager, patient care coordinator were some of the common ones. So again, it kind of added a little bit to the confusion, and it's a really great question, and I hope that kind of clarifies that you really want to look at the skill set that they're asking for and what our curriculum provides you when you apply for the jobs. And of course, master's job is a master's level job, which a lot of master's level jobs will just ask for that, and you would qualify for those leadership jobs.
Am I eligible to apply if I have a BS in psychology or business, but also have an RN license?
Okay, yes, you are. So we do have, though, RNs that went to get their ADN but have a degree in another field, and you take the same curriculum as the BSN folks, but you do need to take 505 and 506 so that you can get your community health curriculum down, which makes you eligible for the public health nurse certificate. So if you wanted to do public health nursing, you could. And we do not have you take, though, the introductory research class or the writing class because you have a bachelor's degree in another field. So you take, I think it's 4 less units or maybe 6 less units than a regular ADN nurse.
Are there any minors available? And if so, would you recommend it? So, for example, can I become a public health nurse?
I think in the previous question, I answered the public health nurse that ADN nurses, diploma nurses will be eligible to get their public health nurse certificate at the completion of their master's training. So you do have to have a degree posted, and you just send in a check for $75. You apply for the certification. You put down that you got your degree with us, and the BRN knows that we meet requirements for the public health nurse certificate because we're certified to do that. As far as other minors, you really do not have time in the curriculum for other minors. You would have to pay more for it. We certainly have minors, but they're more bachelor's degree oriented, not really for the master's oriented nurse. And like it's because it's accelerated and you're working. It really we've actually not had anybody come up to do that. Costs and time, I think, were the main reasons.
So if I am unable to complete the program within 2 years because of family situations and such, is there a maximum amount of time that the university will allow to complete the program?
You can take a leave of absence from the program. Usually the leave of absence is for 1 year, and then after the 1 year, if you want to come back to the program, you need to reapply. As far as like the credits you've already taken transferring over, I believe that within 5 years of being taken count as far as transferring them into master's level courses. So I hope that answers the questions. The leave of absence is for 1 year at the most, and then we will automatically allow you when you're ready to come back. But if it's longer than the 1 year, you need to reapply. Again, I can't see us not allowing you to come back unless you were not in good standing or something, but there's been no reason for us to be motivated not to have you come back into the program after 1 year. And 5 years is usually the rule of thumb for datedness of a master's level course. So even if you decided you wanted to transfer to UCSF with the classes you took here, they'd want them within 5 years as well. That's usually the rule of thumb.
Now we have a number of questions coming in about the application deadline. We are still accepting applications for spring, which starts in January for San Jose and online, and we're going to continue to admit students until classes are filled. So if you want to apply, within the next week or two, please feel free to do so. I believe that's all we have for questions, but we have provided all the admissions team contact information from our San Francisco, San Jose, Pleasanton, and Santa Rosa campus. So if you need to reach someone directly, you have very specific questions, you can always email them. Also, feel free to like us on Facebook and follow us on Twitter. We're big on social media, so we always like to hear all the good things that we're doing out there. Again, we will follow up within the next 3 days with application fee waiver as well as a recorded webinar. Once again, thank you for being a part of this webinar. We really appreciate your time, and we look forward to your application.
Thank you. I look forward to seeing you guys at orientation.